Hello?
I need your assistance stat. There seems to be a 17-year-old girl that's been in a car accident.
Alright, I'll meet you in the ER ASAP. What's the diagnosis?
I don't know, doctor, but there seems to be other patients that were admitted after this one that have also been in accidents. You need to come here quick.
Okay, alright, I'm on my way. Where did you say you found that? On the side of the road? I'm not sure just yet, but I'll have to have a look for myself. It doesn't look like a car accident. You didn't find an ID? Listen, I'll call you back when I have the answer for you. Bye. There seems to be signs of dyspnea. Cyanosis. The patient appears to be unresponsive. Guess I'll start to check your vitals. I can't seem to find a pulse. You must have one though, because only dead patient can get pulses, right? Oh my goodness! You feel about 110 degrees! How is this possible? Let me check your respiration. Well, you have 14 breaths per minute. That's within normal limits. It also sounds like you have pleural effusions. I need to check your blood. Okay. This also indicates hypoglycemia. This patient appears to be having chest pains. I want an X-ray on the abdominal cavity to know what we're dealing with here.
Anything else, sir?
Yeah, can I also get a CT scan and an MRI? The way this patient keeps acting, well, just tell me the results, sir.
Doctor, the patient seems to have suffered from traumatic brain injury.
What? Well, that makes this all the more peculiar. What did the X-ray show?
There seems to be an abscess just inferior of the epidermis.
An abscess? Well, is it benign? Are there fractures?
We're not sure, sir, but it's about 8 centimeters in diameter. If it's malignant, then the patient will be dead within an hour.
The patient is not in their right mind, and we don't know any of their family or relatives.
Doctor!
What?
The patient started to uncontrollably bleed.
Did the patient experience any trauma? Is it intracranial hemorrhage? A hemothorax? Was there any signs of ecchymosis?
Doctor, you're asking a lot of questions, aren't you? Shouldn't you be going to the patient?
Quickly prep the patient for an exploratory laparotomy. Also, subordinate, learn your place. I know what I'm doing. Quick, make sure there are antiseptics to give the patient and blood transfusion so we can avoid hypertension. Where's the blood coming from?
Sir, it seems to be coming from the vestibule.
Okay. Well, when was her last menstrual cycle? Okay.
The patient seems to be in their 3rd trimester.
To be sure this is a prima gravida, we have to do a vaginal examination. What's that? The placenta? Go.
Doctor, never mind that. Quick, give them CPR.
Grab the crash cart and make sure it has a defibrillator.
Doctor, what's the date of birth and date of death?
Well, date of the death of the patient is October 27th, 10:20 p.m. And the date of birth is October. Date of birth? The patient never showed any signs or symptoms of pregnancy, though. How far along was the embryo?
Sir, the patient delivered a fully developed fetus.
There was no signs of embryonic fluid. There was no umbilical cord. There wasn't even signs of lactation.
The child has normal levels of consciousness.
Wait, who performed the cesarean?
Dr. Nicole performed the cesarean while looking for the abscess. Then the uncontrollable bleeding started. While stopping the blood and trying to figure out the problem, she noticed the baby and managed to save its life.
Here's the baby!
3,